Hello.
Hello.
Listening to each other, what did you find that you had in common? Katrina?
We were just talking about the percentage of insomnia in the workplace. I would think that we agree that it's a lot higher than what we would expect. And we know that in workforces, particularly in workforces such as first responder organisations, this is a huge risk factor, absolutely huge, because we know that with poor sleep comes poor decision making, lower mood, and lowers your inhibition as well. So that's extremely worrying across our industry, I would think, John.
Yeah, there's it was interesting. Murphy Pipe and Civil, when the Surat Basin gas fields went off, we were working with them, and they had fly-in, fly-out workforce, and they had an iPad that when you got on the plane, you did your tickets and whatever. It also had this survey that they got them to fill in about their mental health. They did it anonymously, and the number one contributor was sleep. And so for FIFO workers, there's, I mean, if anyone's ever done any FIFO work, I can tell you, I understand why it's lack of sleep. You're in a tiny box, normally plastic walls. It's, you know, certainly not luxurious, but lack of sleep came up as the number one contributor to their mental health.
And in your experience, the insomnia was stress and anxiety work-related, as you were outlining, Margot, as well.
Yeah. I think it is. I think it's, you know, it's quite often the very first thing that if you notice your sleep changing, it's a first indicator your mental health is changing. Right. So from an individual perspective, I think it's something we can self-regulate ourselves, but it's also about how do we check in with our colleagues. You know, did you have a good night's sleep last night? Those sorts of conversations. And I think we've got to recognise that there are going to be industries that are prone to having sleep as a major issue, and quite often those industries are talking about it, they're measuring it, but I think it's the bricks and mortar, big buildings, you know, office workers, the organisations where we probably don't recognise that sleep is likely to be an issue, and yet it actually is.
John and Katrina, I mean, you spoke at length about, you know, introducing new programs and new thinking at the workplaces where you are. John, in particular, you know, coming into a very traditional place like construction. But can you talk a little bit more, I guess a bit more generally, in ways that might be applicable to people in the room, about even starting off that conversation about cultural change around mental health, John?
Yeah. When we started, we were like lepers. No one wanted to touch us. You know, like, that's a home issue. They can deal with it back there. I remember one bloke, just a manager of a CEO of a multinational company, just said, John, mental health is for soft cocks. Don't come in here and talk about it. He would never dare say that now because we have a precedent. And I think it's hard work. And our goal wasn't to build mentally healthy workplaces. That's a product. Our goal was to change the culture. So, for example, the word suicide was never mentioned. So we started to mention it regularly. Just finding champions in different work sites and starting to work with those who wanted to work. Not look for those who didn't, but work with those who did. And slowly they started to influence, and your influence grows.
Yeah, and we had a very similar experience actually. No one wanted to talk about health in a policing agency because everyone's fearful for what the consequences will be. But you've got to get police to talk about it. You've got to get the workers to talk about it. Because I'm just the doc. They're not interested in what the doc has to say, but they're interested in what their police mate has to say. So once we got police talking about it, we really started to change the conversation. And what's important is that we spoke to police about, you guys own this. We don't own this. Health is not the domain of the clinicians. Health is not the domain of the doctors and the psychs and the nurses that you employ in your organisation. It's over to you. We'll give you some tips and some advice, but it's over to you to own this. And that's really where we started.
Do we have any questions in the room? And I'll do my very best to not miss any hands this time. Any hands up at all? You know you're just going to save it till the end. There you go. So we have one here. There's one. And where's two? Let's see if we can find a second one before I go to our digital questions. Okay, so we'll come to you first. And stick your hand up. I'll keep looking out to see if I can find you. Hi.
Hi, I'm Sophie Boyes from EML. I was just wondering the panel's views on how you use support systems for workers. So when I say support systems, I really mean husbands, wives, partners, family.
Who'd like to start? John? No? Yep.
Katrina, I'll let you go first.
Oh, I was going to arm wrestle you for it, John. Yeah, Sophie, great question. In first responders, families are critical because they often detect ill health well before the worker does. And they're often the ones saying, go and get some help. And then it's 2 years down the track and the spouse says, I'm done. I can't cope with this anymore. So we really engage with them at a worker level. And part of our peer support program is to support families. We need to do a lot more engagement with families, particularly for our people in high-risk areas and internationally deployed areas. But we're just starting the conversation with our workers to say, your family is important to us.
Yeah, we did a bit of work in the workplace. Because of construction, you're often off work for injuries, and they can be long-term injuries. And we found that a lot of the people on long-term injuries away from the workplace, their mental health was spiralling down, even though their injury may have been getting better. And so we started to work with the workplace and say, when we spoke to these workers, they said, I don't miss work, but geez, I miss the crib up. I miss the banter where I was part of it. So a number of workplaces now, if a guy's off sick, they have a roster, and it's someone's job to call around or to ring up or to do that, which gives them that sense that they're not forgotten. And also we've done some work with families. It's sort of hard in the space we're in to work with the families. We offer support to families, particularly after suicides or suicide behaviour. But we did a lot of work with FIFO wives in places like Gladstone and Moranbah and places like that, where they became a support for one another. Because when the key person's away on, say, a 28/9 shift, they're remote from the family in lots of ways. Some of these places don't even have internet so they can ring up properly. So that sort of support we found really useful. Hope that answers the question.
It's a question that's come in via the app. In each of your industries, do you see a difference in acceptance or openness to culture change and talking about mental health? A difference between younger and older workers, or a difference between workers and executives and leaders? I'll get you to start on that, Margaret.
Certainly, I can answer it from the results as well as from the industry piece. So the results are that typically in large organisations, they do policies and practices really well, and the higher up in the organisation you go, the rosier the glasses. In smaller organisations, they may not have the policies and practices in place, but they live and breathe them. So it's a sense of culture that's a family-oriented. It's quite often a culture of care that's embedded and ingrained in the DNA of that organisation. So we've got to, in some ways, help large organisations learn how to create that better, reach out to families, other things than we see. In financial services, we absolutely are seeing a major change. Royal Commission, a number of other triggers, but major changes in creating a culture of care.
And generationally, is there a difference in openness? You're nodding, Katrina. I'll get to you.
Huge.
Absolutely. I don't have any results or stats on that, but we are absolutely seeing that in results of conversations.
Yeah, we have a significant difference in the generations, and younger recruits that are coming through now, they complete their training program and they go out on the road and they're expected to perform their duties immediately as soon as they hit the road. And they're asking questions like, oh, why do we do it like this? Or I didn't feel great about seeing that death, or I didn't feel great about seeing the domestic violence against the children. And a couple of years ago, the older coppers are like, what are you talking about? You don't feel great. We're not going to talk to you about that. That's not for the job. But now we're seeing that younger generation is actually really influencing that older generation, and it's really wonderful to see.
What about in your industry, John?
Yeah, it's probably three things. I think we're driven by liability. So we put mental health in the safety space. Just said if you don't deal with it, it's a liability. So they didn't have to do us, but they need to do something. So that conversation from that CEO of the multinational company, that couldn't happen now because we've set a precedent that we have an issue and this works, And if you're not doing anything, you can't. So at a larger level, stuff's happening. And just recently, we put together a blueprint for mental health in the construction industry across Australia. Now, it's embryonic, but all the major players come together. That would never happen. So at a top level, yes. We've got 11,000 connectors, and we've taught them how to debrief. So when they have stressful events on the work site and whatever, they have some skills around debriefing. And this is a bit crash, but it came from one of these guys. He says, all I said to my workers, he's a plumber, he says, it's like this. When we go to work, we work in shit. If we don't wash it off, we take it home and spread the shit all around the house. He says, so when we're working in stressful situations, it's just like shit, it sticks to you. If you don't wash it off, you take it home, you bite the dog and kick the cat. I said, well, how can I argue with such a beautiful analogy? And certainly there's some evidence that young workers feel freer to talk about it. That we've got some really interesting research right now about the severity of bullying and harassment amongst young workers, but there's certainly more of them are prepared to talk about it, and more of them, interestingly enough, are prepared to seek help, which is really different than the majority of their workplace.
I've got a little question here if I don't have one in the room. No hand? Okay, well this is quite nice, so we can maybe just quickly run around all of you on it. If money was not an issue, what would be the one thing that you'd implement to improve the mental health of Australian workplaces? We'll start with you, John.
Mine is really easy. You do not work on weekends.
Right.
I'm serious. We've got workers who are working 12 hours a day, 6 days a week. Yeah. Some of them are working 17 hours a day, driven often by government tendering processes. I would just say you work a 10-hour day and you do not work on the weekends, and it would be a massive... We've got research around this already. People like Centre Group and that are already implementing this. It has made a massive difference to the mental health of the workplace.
Weekend drivers around the country would thank you if the building sites would stop bloody working of a weekend too, I think. You can't move in Melbourne. Margot?
I think it's about capability of having a really good conversation that comes down to training. Training frontline leaders is known to be best bang for your buck for creating a culture of care and stepping in and having those conversations of noticing those early warning signs.
And for first responders, I'd like to see us move to a model of non-liability healthcare. So military personnel in this country have subsidised healthcare access to general practitioners and specialists, but first responders pay to see their GP and pay to access health. So that's what I would do.
Will you please thank our marvellous panellists this afternoon, Katrina and Margot and John.
Thank you. Thanks, guys.